Sure, no questions for Khadine? No comments, no additions? All right. We're going to move into our first public policy session, which is social environment and healthcare access. And I'm actually going to turn it over to the moderator for that panel, which is the lovely and phenomenal Kim Hunt.
So first of all, good morning. Good morning. And thank you again for coming out. Just a reminder, there are navigators here, so if folks haven't signed up for their health insurance, this is a great time to do that because you have until December 23rd if you want your insurance coverage to be effective January 1st. I am not going to take a lot of time because this panel is phenomenal. I was rereading all of the bios last night and I went, oh my God, I can't wait to hear what they have to say. So I'm not going to say much. I'm just going to read the bios and then why don't you guys just come up as I read your bio. So Khadine's bio we've already read. So Khadine is joining us for this panel. And this panel is on school environment and healthcare access. I won't reread Khadine's bio.
Why didn't do a lovely job?
You did a fantastic job. And I should say, we're kind of doing this piece in pairs. So we have a couple of people who are going to talk about the policy, and we have a couple of people who will talk about the context necessary for making sure we understand the impact of that policy. So next we have Caryn Curry, who is the director of, and a serious affinity friend. She was on the softball team too. But she does more than play softball. So Caryn is director of prevention and medical health at Mental Health America of Illinois. I love that title. Mental Health America of Illinois, where she has worked since 2001. In that capacity, she has administered and implemented statewide community-based initiatives that address mental health promotion and the prevention and reduction of mental health challenges. Since 2005, social and emotional learning has been the primary focus of her work. From 2007 to 2011, she coordinated the statewide social and emotional learning standards professional development project for the Illinois Children's Mental Health Partnership. And she currently provides training, consultation, and public awareness to school and community audiences in Illinois about the critical role of social and emotional learning in school and life. As Director of Government Relations, Ramon Gardenhire, where's my guy? There he is, oversees the AIDS Foundation of Chicago's advocacy and policy work at the state level. His areas of focus include the implementation of the Affordable Care Act and ensuring that new federal and state health care systems meet the needs of people living with and affected by HIV, Medicaid policy, state budget and appropriations, health care and HIV-related legislation and policy, and the Illinois AIDS Drug Assistance Program. Ramon serves as AFC's state lobbyist, working in Springfield to enact sound HIV/AIDS public policy, defend the rights of people with HIV/AIDS, and advocate for increased services and prevention for people living with and at risk of HIV/AIDS. Next we have Dr. Travis Gayles, a native of Chase City, Virginia. He graduated from Duke University with a BA. This brother, when did I read all these degrees? A BA in Public Policy Studies and worked for the Institute of Medicine study on pediatric end-of-life care. He completed his PhD in community health at University of Illinois in 2006 and postdoctoral training at the National Cancer Institute. In 2009, he received his MD from the University of Illinois College of Medicine and subsequently completed pediatrics residency at Northwestern and Lurie Children's Hospital of Chicago, where he is currently clinical instructor of pediatrics in the Division of Adolescent Medicine at Lurie Children's Hospital and the Northwestern Feinberg School of Medicine, and is completing a research fellowship with the National Institute of Mental Health on Violence and Victimization in Young Adults. Additionally, he's an adjunct professor with Northwestern's Institute of Public Health and Medicine and the DePaul University's College of Health Science, and is a member of the executive board of GLMA, Gay and Lesbian Medical Association. Wow. And the and the Chicago LGBT Health Advisory Council. And last, and I'm going to grab another chair here. You got it? Okay.
I bring my own.
All right. We have Dr. Phoenix Matthews, an associate professor and clinical psychologist at the University of Illinois Chicago. Phoenix is nationally known for health disparities research with underserved populations, primarily focused on the development and evaluation of culturally tailored cancer risk reduction interventions. Phoenix's most recent research focuses on the use of community-based and culturally tailored health promotion interventions to reduce risk factors associated with cancer disparities. Phoenix currently serves as the co-principal investigator of an NIH-funded study to conduct a randomized clinical trial of a culturally tailored and non-tailored smoking cessation intervention for LGBT adult smokers. Dr. Matthews is also the Director of Recruitment and Retention Core of UIC Center for Clinical and Translational Science, and is the Helen Grace Diversity Scholar in the College of Nursing at UIC. So, let's welcome Mr. Bennett. So we are going to talk, so the order that I announced you in is the order you're going to speak in. And so we're first going to talk about some school environment legislation, and Khadine, feel free to add any other legislation that you're aware of that we need to, folks need to be aware of. So mostly state level first, and then we're going to move into some recent city ordinances, one that is passed and one that I think is still kind of making its way through the system. So I'm going to step aside and let you guys do your thing. I know we have this projector here, so you might want to stand when you speak so that people can see you. So we'll start with you.
So, hello again. It's been a long time since I spoke to you. So today I'm going to talk to you about an anti-bullying initiative that we actually tried 2 years ago. And before I tell you about the bill, I have to tell you how we did not pass the bill, which still drives me really, really crazy. So this bill basically, so in 2007, Illinois passed an anti-bullying bill, creating safe environments for students, defined what bullying was. There was also a task force that was created to figure out best practices to deal with bullying in schools. One of the things that task force came up with was that you'd say you need to have a policy on bullying, but for some schools it's helpful to figure out what those policies are. So we should define those components of a policy. So that was the bill that we introduced in 2011. It was an election year, and you know, bullying is one of those things where you hear about young people who are killing themselves because they're being bullied in school, harassed. And our definition of bullying is pretty severe. So it's ongoing harassment and threats. A student would feel unsafe coming to school, or they feel like they're not able to learn in school. So it's not just like me telling Ramon, I don't like you, you're awful, I hate you. It has to be something that puts him in fear of his life or safety, or unable to do his schoolwork. And so the opposition that we had was from the Illinois Family Institute, and their main opposition was that our bullying bill would indoctrinate kids into being gay. And that was kind of a unique thing, since you know there's protection for students regardless of their sexual orientation that was already done in 2007, and our bill just created a policy, defined what a policy was. And the rationale is, well, part of what a policy could say is you do some kind of intervention. That could mean you may have somebody come in to do an assembly, and that could mean that somebody can say, gay or straight, black or white, you should be treated with respect. By virtue of that, that person would kind of say it's okay to be gay, and then you've indoctrinated all these kids into being gay. So when I first heard it, it's like, there's no way that this is going to have any legs. It's crazy. It's an election year. Everybody loves anti-bullying legislation. Turns out, no. So this bill barely got out of the House. Thankfully, Rep. Harris, he voted for it. It was sponsored by Representative Kelly Cassidy, and it became about who our sponsor was, that if you have a lesbian woman who's sponsoring a bill, it must be because she has a hidden gay agenda. And there were articles that said that out loud. So that's the climate that we're dealing with in Springfield. Never mind that she's a mom of 3 kids. She understands the issues. She has parents who are calling her. So got out of the House with 61 votes, I think. We needed 60 votes. And then in the Senate, this bill, we tried to run it twice. Both times it failed. The first time it failed because not everyone was on the floor. People who were yes votes decided to flip. And then when we tried again, we had a one buffer, so we had a vote of 31, supposedly. And then when it came down to vote, one person flipped their votes again, and one person who our House sponsor just had a conversation with him because he didn't vote last time to say, the bill's coming up now, it's time to hit your button. He didn't vote because he just didn't. And so this bill failed. In the meantime, we've had kids who have continued to be bullied. We've had schools who are still struggling to figure out what a policy is. So we are reintroducing this bill in this session coming up. It's another election year, so I'm hoping that folks will feel extra heat around this issue. So what the bill essentially does when we say a policy on bullying is that it says a school policy that schools are now required to have under the law should include the definition of bullying in the section. That's a way for teachers to understand the difference between bullying and the difference between kids acting out, being jerky, but not bullying. That's a very legal
Oh, I like it. I'm writing it down.
It also should have a statement that says that it's counter to state law and counter to school policy to have bullying in school. It should also include procedures for reporting bullying, including anonymous procedures. We've heard from some parents that kids are bullied and they have no idea who to go to. And they want to talk to someone, but they don't want the teacher anyone to know it's them, so they don't report. So having that structure in place is pretty basic, simple. It also would include procedures for prompt investigation and addressing the reports of bullying, because you have parents who are saying, well, this has happened to my kid, we made a complaint, but nothing's happened. And I just want to be clear, what the next part of what the bill does is that it would include interventions that can be taken to address bullying, including restorative measures. And I think that's a pretty critical part of this bill, because when we say we want kids to feel protected, we want all kids to feel protected, and we don't want to push kids out of schools. We don't want to create a situation where you're a bully, so you need to get out of the school, and you're expelled, you're suspended, because kids bully for a reason. Sometimes they're bullied at home, in their community. Sometimes the bully is also the kid who has been bullied. So what are the ways that we can deal with this issue without increasing that school-to-prison pipeline, without pushing kids out? And that's a really, really important component of this bill. And it's, I think, according to some of the people we worked with, it was really important to get this whole idea of restorative measures into the school code. The other thing that it calls for is engagement from a range of stakeholders, including parents, the students, school administrators. So if this bill becomes law, it's an opportunity for folks who are parents or caring community people to be a part of that process. Because if you care about school push out, if you care about the school to prison pipeline, that's the time where your voice can be there in terms of crafting the very specific policy that would work for your school. And then it would have to be posted on a website and given to new employees and given to teachers every year. So the only other thing that we're trying to do with this bill is to create a data collection component, because we want to know what happens when something's been reported. And it's not a way for us to get schools in trouble, but it's to say, okay, so you had 20 incidences last year, 50 this year, something's happening, and have you taken any kind of intervention at all, and what does that intervention look like? So this bill, once it's filed, or before it's filed, we'll probably reach out to you for your help in being part of our coalition. It's a really important issue, and if you have questions, please feel free to ask.
Good morning, everyone. So Khadine mentioned some prior legislation to the legislation that's in process now, and some of the work that I do with regard to bullying comes as a result of the first legislation. There was, you mentioned the task force. That was one of the mandates that came out of the legislation. And this is the school-based bullying, I can't remember the name of it, Bullying Prevention Task Force, I believe. And there is a coalition now in the state called Prevent School Violence Illinois that was created out of, or this iteration of it anyway, was created as a result of that legislation to try to actually implement the recommendations from this 100-plus page report that was sent to the governor. And I'm going to read a couple of the recommendations from the report because it speaks to social emotional learning, which is really what I want to share with you a little bit about for the next few minutes. So, recommendations. One of them says, to effectively prevent and address bullying and school violence, education stakeholders in Illinois must commit to engage in overall school transformation. They must fully and consistently implement mandated social and emotional learning. And then in quotes, this is a quote from the recommendations, when SEL, that's social and emotional learning, is fundamental and consistent for all school-based education and for all students and school personnel, bullying prevention will be accomplished. And so the work that I do, as Kim mentioned, revolves primarily around social and emotional learning. Raise your hand if you have any familiarity with this notion of social and emotional learning. Most of you do, fantastic. So the definition I like to give around social and emotional learning is the process of any person, we're not just talking about students here, right? Any person on the planet acquiring the skills that all of us need to navigate the world, period. That's what social and emotional learning is about. So it's really critical for all of us just to do life. Fortunately, for all the crazy stuff that Illinois does legislatively, 10 years ago, Illinois became the very first state in the country to actually create, legislate, mandate that social and emotional learning standards become part of Illinois academic learning standards on same par as everything else, language arts, science, foreign languages, math, whatever else is there. 10 years ago, that legislation was passed. 8 years ago, the SEL standards were created, and there was some short-term funding provided for the State Board of Education and the Illinois Children's Mental Health Partnership to administer a professional development process, which I had the privilege of working on. I go into schools frequently now in 2013, and I'll ask educators, so who's heard of social emotional learning? And there are still faculty meetings, administrator meetings, where I will get less than 25% of the educators raising their hands, okay? The good news is that I also go to conferences, and just talk with colleagues and folks who may not be educators, but just who are in the business of supporting kids and families, and some educators as well, and mental health professionals and other folks just doing good work. And social and emotional learning is a part of the conversation, a lot more than it was 5 years ago, 6 years ago, 10 years ago. So even though, schools are not necessarily being accountable to this mandate that they need to be held accountable to, the window is open for folks to begin to work more intently, more intentionally on helping children and adults to know what these skills are, and more importantly, to do these skills, to implement these skills, to learn these skills, to teach these skills. So let me take 1 minute just to say, because we said, yeah, we know what SEL is, and I asked that question, and there, for 10 people who raised their hand, there are 8 different definitions. So let me tell you how I understand social emotional learning. There are 5 basic skills that all of us need to get along on a planet that's social, right? We need to be able to identify our emotions, okay? We need to know about self. So self-awareness is the first thing. Who am I? Who am I in the context of other people? How do people look at me? What is it about self? How am I? Who am I in the world, in a space, right? Self-awareness. Once we have self-awareness, we need to know how to manage self. So in schools, there's always a lot of, the non-academic stuff, a lot of it's about behavior, and kids who are acting out, and poor behavior. Well, behavior happens for a reason. There are emotions, right, that contribute to those behaviors. And so when we're talking about being respectful and being responsible, if we don't say what that means, and then teach kids the skills that they need to do that, how do they learn to manage the behavior? Be respectful. Okay, I only hit him once, right? Because I was never taught what that means in the context of this school. And Mrs. Jones may have a different definition of be respectful than Principal Johnson, right? So Ms. Jones and Principal Johnson, the community and the school and the youngster need to come together so we can all be on the same page. So that youngster can self-manage and is not having to be multicultural in a whole different sense, because mom's got a set of values that are different from the school, and the same words mean two different things. So that's self-management, right? Then we've got to have some social awareness. There's one of Caryn in the world. There's one of each of us in the world and billions of other. If I don't know how to deal with other, and I'm not talking about tolerate, I'm talking about embrace. Respect that you are different from me. There can be nobody like me, so you must be different. And if I want to function in a social world, I've got to be open to understanding that you think for yourself. You look different from me. We may never agree on anything in the planet. That's okay. It's okay to agree to disagree. Conflict is a positive thing. And you talked about the distinction between bullying and jerky behavior, right? Jerks are in conflict. We're all in conflict. That's positive. We can learn from conflict, but not if we don't have social awareness. Empathy is a huge aspect of social awareness. And so we've got to teach. These are skills that can be taught. Well, parents are supposed to teach them. Yes, they are. And educators are also supposed to be preparing young people to be the most ready that they can be for whatever their next step is. So we're talking about a partnership, folks. We're talking about community who need to be about academics and self-awareness and self-management and social awareness. And then the next thing is relationships, which is really what all of this is about. How are we in relationship with the person I'm standing next to, with the person in the back of the room, with my next door neighbor who I've never bothered to go say hello to, in school, in the grocery store, wherever you may find yourself. That's what all of this is about. I didn't say relationship first, though, because you got to know self and you got to know other to be in a relationship. And then the last thing is about making responsible and ethical decisions. So think about these 5 little skills. Think about your own life and how you get along in the world. These are essential for all of us. And the thing that I want to say before I sit down is, well, actually a couple things I want to say. Two things. I am cajoling you, if for any of you who have any access to any public school anywhere in the state, to always be asking the question, what are you doing about social and emotional learning in your school? Now, I will say that CPS as a district is doing their best. They are improving in terms of really making SEL, embedding SEL in schools and teaching those skills to kids. We know CPS is a large, unwieldy district that reorganizes every second week of the month, right? And so they need some help. They don't need us to be on their case all the time, which I am too often, but they need our help. So we want to be asking those questions. What are you doing and how can I help you? Because these are our kids. These are our kids. The other thing that is imperative is that we must be using these skills that I just talked about. We are killing our children. LGBTQ and whatever, and we are killing our children simply by living our lives, often not aware of the tremendous impact that our behaviors have on our youngsters. When we don't have our own self-awareness, when we don't manage ourselves, right? You know what I'm talking about. We must make a decision that if we want our children not only to thrive in school, but to live, that we have got to do differently as adults in the terms of the way that we talk to each other, okay? Work with one another or choose not to. The kids are not going to get it out of a book. Their teachers don't even know SEL exists, okay? And whether SEL exists or not, whether there's a mandate or not, we're talking about some basic civility, folks, okay? There's a lot of stuff that, we're talking about coalitions and coming together and this and that. The way we talk to each other, that's the core of everything. The way we're in relationship is the core of everything. So I just invite you to, I don't know if we have contact information about that. Okay. I invite you, if you'd like to learn more specifically about social and emotional learning and or Prevent School Violence Illinois statewide coalition, which is about social and emotional learning in the interest of preventing bullying. Because with SEL, you can prevent a lot of stuff. It is a violence prevention effort. It's a bullying prevention effort. It's a substance abuse prevention effort. Because what it does is arm people internally to make the decisions that enable them to thrive and be healthy. Thank you very much.
Good morning, everybody. Good morning. So I don't know about you guys, but I happen to be a visual learner, so I have a PowerPoint. I promise I won't go through every slide, but some of the information that I'm going to give you guys, yes, thank you. Some of the information I'm going to give you guys is important to also take back to our communities, so I wanted to make sure you had information to take back to continue to have these conversations. So we're having some technical difficulties, but that's okay, so we can just use paper. So before I started, I know that Representative Harris is also here wearing the hat of chairman, as wearing the hat of being the sponsor of Senate Bill 10, but also wanted to make sure that we have conversations about ways that we can kind of build bridges to other issues which are really important. In addition, he also is the chairman of the House Human Services Appropriations Committee, and it's really, I'm glad that he's here. It's really important as we have conversations about issues that impact and have ripple effects outside our community, that we have conversations around issues that, in terms of finances, whether it's services for HIV, services for mental health, services for housing supportive services. All those conversations are really important as we kind of build bridges with other constituency groups. It's really important that we have those conversations, so I'm glad that Representative Harris is here as well to kind of impart in some wisdom and also take part in this conversation as we move forward today. So with that being said, some of the things that I wanted to talk about, let me see here, obviously is our state budget. As many of you know in this room, Illinois is in a continual fiscal deficit. And so part of that kind of ripples out as I talked about, because then we have a deficit. We have to decide what things are important to us as a community that we value in funding adequately. And so unfortunately, we've always, what that does, unfortunately, it puts different communities against each other, right? So you have, education over here saying we want adequate funding. You have HIV over here saying we need adequate funding. You need, mental health services, supportive housing. Hopefully, the dialogues that we begin to have today is a way that we can all come together and say, instead of us trying to carve out our little specific slice of the pie, how do we grow the pie, right? How do we make the pie bigger to make sure that all those services, which are vitally important to all of us and to all the communities that we represent, are part of the conversation too. And so one of those ways that we can do that is so that, unfortunately, Illinois is one of the few states which does not have a progressive tax or a fair tax. And so it means that we have a flat tax. And unfortunately, what that means is that we are always at a structural deficit in terms of the amount of money that we're bringing in. So we have less revenue that we're bringing in out of the expenditures that we have. And so there is now a proposal in Springfield, a House resolution and a Senate resolution, which will put a constitutional, and that's codified in, unfortunately, in the Illinois Constitution, which says that we have a flat tax. And so there is now a constitutional resolution that is being prospered in the Illinois General Assembly, both in the House and the Senate, which will basically say that we should put this on the ballot in the next election, next year's election, to say that should we move forward to have a progressive tax, which the vast majority of most states do. Because what happens is if we don't have a progressive tax, a flat tax disproportionately hurts people who are at the lower income rung than those who are higher. If I'm making $100,000 a year, a 10% tax bill is not going to hurt me, right? It's not going to put me in a poorhouse. If I'm making $10,000 a year, a 10% tax bill is going to dramatically affect what purchases I can make, the investments I have to make sure that my kids and the families that I support make sure that I have adequate funding. So I think that's really, really important. So that's one of the things that I want to talk about in moving forward. Another issue that I think is really, really important moving forward is that making sure that we all, Kevin talked about we have in-person assistants here who can help enroll into Obamacare, healthcare reform, whatever you want to call it, whatever terminology. It's really important that we have that, but now that we have it, we have to make sure that it's implemented in a way that's effective and that make sure that we can make sure that everybody has access to really reap the benefits of this. So one of the things I really want to be a champion for is making sure that people understand healthcare reform and are able to access it. So for instance, how many people in this room know about Medicaid expansion? Great, wonderful. So for those of you who don't, so Medicaid traditionally has been what we call a categorical program, which means in addition to being poor, you had to meet a certain category in order to get Medicaid. So you had to be poor and disabled, poor and have dependent children, poor and elderly. So if you didn't meet one of those categories, you couldn't get Medicaid. And so that left a huge swath of people who had chronic illnesses, mental illnesses, that weren't able to get healthcare access. With Medicaid expansion, which we passed this year in Illinois, the governor has signed, it will allow individuals, there's only 2 requirements now. One is that an individual makes under $16,000 a year for a single individual, and it's about $22,000 for a couple, and that you be a resident of Illinois. That's it. That's it. And so I know that many people have been, unfortunately in the news, there's been lots of stories and hand-wringing over, the marketplace website's not working. I'm actually here to say that the state has done a really, really remarkable job of being able to enroll people into the Medicaid program. HFS, the state agency responsible for Medicaid, is enrolling up to 2,000 people per week, into the Medicaid rolls. And so this is a great way to make sure that people who, before in our communities who had diabetes, HIV, mental health issues, were not able and accessing high quality healthcare coverage, can now get that coverage. And that's really important as we talk about these kind of other issues, because if somebody is impoverished and they have mental health issues, if they go to the emergency room, the last thing they're going to do is kind of worry about taking their mental health medications because they don't have any place to go home to. So all these issues are interconnected, so that's why I'm bringing this up. Another issue that I really wanted to talk about is making sure that people understand the insurance marketplace. We have it, and I think it's really important that we educate ourselves and we start to use it. How many people are, obviously, I'm sure that you're familiar with the insurance marketplaces. But again, I'm here to say that Illinois is doing a really remarkable job of marketing and getting people enrolled into the marketplaces. The way that the marketplaces works, and again, I am not going to spend a lot of time on this because, again, as Kim mentioned, we have in-person assisters and navigators who can actually sit down with you and help you enroll. And also, if you already have insurance, but you know family members, friends who are uninsured, sit down with in-person assistant to make sure that you have conversations with these people to see how you can get those people enrolled into the insurance marketplace. The way that the insurance marketplace basically works is this, is that an individual who makes under $44,000 a year for a single individual is eligible for a tax subsidy. And for the vast majority of individuals, that tax subsidy will cover the vast majority of the premium, so that their out-of-pocket expense for insurance coverage. And basically, it's for many of us who have private insurance, this is their ability to have private insurance, high-quality, comprehensive healthcare coverage. And so an individual will go to the marketplace, they'll say, I make this much money, I have this many dependents, they'll kind of give some kind of demographic information, it'll spit out information also based on geographically where you live at, and say, here are the 100 plans which you can pick from. And so then at that point, the individual can sit down with their person and sister, walk through what their specific ailments are, who their primary provider is, make sure that they're still part of that network, and then that individual can then go through that process and make sure they have comprehensive healthcare coverage. But just as important as making sure that we have high quality healthcare coverage, we have to make sure that the coverage there meets all the needs of individuals in the communities that we represent. So unfortunately, in 2011, the General Assembly passed the SMART Act. And what this did was, unfortunately, the Medicaid program was hemorrhaging money. So this was a way to address some of the overwhelming costs of the Medicaid program, but unfortunately, they cut many of the vital services which people need in order to stay healthy. And one of those was adult dental services. So unfortunately, now an individual currently on the Medicaid program who's an adult, the only service for dental services they can get is an extraction. So this basically means that if a person has an abscess, a dentist can't see them because they can't get reimbursed for those services. So what ends up happening is that this actually defeats the purpose of the SMART Act, because what ends up happening is that that person has to go to the emergency room, and then they have to be seen, and then that actually the emergency room cost is much more expensive than if you would have had preventative services that they can go to a dentist and have those things checked out and resolved at that level. It actually costs 10 times more for an individual to go to the emergency room versus having preventative services at a dental site. And so there's legislation pending. It's already passed the Senate. The Senate sponsor is Senator Donnie Trotter, and then the House is Representative Mary Flowers. And this is also in your handout as well. It's HB 1516, and this would restore dental services back into the Medicaid program. And so this is something that many people are being affected by. This is actually one of the things I heard the most in terms of people being affected by the Medicaid cuts. And so I think that this is another great opportunity. We're talking about ways that we can kind of broaden out issues, which are, yep, Michael?
What is the name of that bill again?
HB 1516, Senate Amendment 2. And the House sponsor, again, it's passed out of the Senate, and so it's currently waiting for a vote in the House. And the House sponsor is Representative Mary Flowers, whose district is just west of her. She represents Inglewood. And so, again, this is a great way for us to kind of build bridges and kind of broaden out issues and build bridges with alliances who may not traditionally have worked with. But this is, again, a way that we can start to kind of bring in unlikely allies to help us fight on many different fronts. Another bill that I think is really important as we move forward is in terms of, again, I'm glad that Representative Harris is here, is that in 2011, the General Assembly passed an income tax hike. But it was for a temporary income tax hike, and so that is set to sunset, which means go away this next legislative session. And what that means is that we are going to have about a $2 billion hole alone in our already really strained budget. And so without advocacy from the community saying that we need to continue the income tax hike, that means that all the services which are really important for the people that we care about, that we work with, whether it's education, mental health services, HIV services, housing services, you name it, we're all facing, off the top, an almost $3 billion cut in the state budget. That's really important that we as a community work together and advocate to make sure that the General Assembly understands the importance of continuing to fund the income tax. So those are some of the things that I wanted to talk about, and of course, I'll be part of the panel, so feel free to, if you guys have other questions about the budget or healthcare.
Good morning, everybody. Thank you for the opportunity to be here, and a special shout out to all of the panelists. From a clinician's perspective, all of the work that they're doing help make our job easier in terms of insurance reform, looking at disparities, getting people covered, and then having an understanding about what coverage means and how that all plays together. And so in spite of my different training in different areas, technology is not one of my finest points, so I kind of screwed up my slides this morning, so we're going to do it old school method. So the topic that I wanted to talk about is generically health disparities affecting the Black LGBT community. Any conversation about disparities has to start, though, in a general term, in a general sense. Even though you have members of a special group, in this terms the LGBT community, we're not excluded from general health concerns of hypertension, diabetes, cancer, and from a youth perspective, HIV, asthma, and all of those kinds of things. So any conversation about health disparities must be grounded with understanding how we fit into the larger category comparing to other people. We know that as folks of color, we're more likely to be uninsured. We're more likely to access care at later points in our treatments. We're more likely to die from preventable illnesses such as, for example, prostate cancer. We know that African American men are 2.5 times more likely to die from prostate cancer than any other ethnic group, in large part because we typically don't get diagnosed until much later in the disease course. All right, so to hammer home some of the points with health disparities, we're going to have some audience participation, so get ready to get up and move around a little bit. All right, for the first part, in talking about population dynamics, we know that the African American community makes up approximately 13% of the population. So if I count it correctly in the audience and so forth, if I have all of the panelists stand up, and Tracy and Kim, and I don't know your name. Tria. Have you guys stand up. You represent the African American population in this country, percentage-wise, roughly 13% of the audience. All right. First round done. So when we talk about the LGBT specific community, let's talk about in terms of health insurance and access. So there was a study recently by the National Coalition for Health Access that looked at LGB, did not include the T, LGB disparities for people of color. So forgive me if my percentages will be a little bit off because they didn't include transgender individuals in the data. So when looking at healthcare access, we found that, all right, first two rows here, stand up. Actually, let me have you stand up too. I'm getting there. So these folks standing up represent the percentage of LGB folk of color who will either show up late to the doctor in terms of after having an abscess or some other illness, more likely to delay treatment, or more likely to delay filling a prescription that has been written by their doctor due to concerns over cost and care. This is 20%. Can you guess what the next highest percentage is for any other ethnic group who within the LGBT population? Next highest is 6%. So 20% versus 6%, and that is for Latino identified LGBT members. Right. So that's just getting to the doctor and accessing treatment, let alone talking about disease-specific disparities. All right? Let's see. So we talked about 13% of the population. We don't really have a good estimate of how many of that population identifies as LGBT, but let's just say hypothetically if it's 1 in 10, anywhere from 3 to 5%. All right? Keep that number in mind. Let me have this whole side of the room stand up. I'll pick on the other side next. All right. So in spite of being 3.5 to 5% of the population, we can maybe guess, new HIV infections for young men ages 16 to 29, we account for over 45% of new infections. Okay, now it's time to pick on this side of the room.
Good, unless you're going to do knee replacements.
And you would not be surprised that there is a clear disparity within knee replacements as well, because most often we will present with much more severe problems requiring a replacement as opposed to doing other types of therapies to get there. You know, a lot of that due to insurance and other issues. All right, first 4 rows here, stand up. And I won't pick on you afterwards. Actually, let me have the next row stand as well. So again, in spite of being 13% of the total population, roughly 3.5 to 5%, if we break those dynamics down a little bit more, you all represent the percentage of LGBT folk of color who have diabetes. Right? Roughly 35 to 40%. Those who have type 2 diabetes. Some of the others are a little bit tricky given the numbers and dynamics, so I'll just kind of run down the list so we have more time to talk about other things. Other disparities, clearly, in terms of breast cancer, we know that African American women are twice as likely to not get a mammogram on time, and then in particular for LGBT folk of color, it increases twofold in terms of not getting mammograms on time and having complications as a result of breast cancer. The numbers aren't as clear in terms of mental illness and mental health, but we know that there are clear disparities there as well. And also in terms of the question of insurance status. We know that roughly 65 to 70% of LGBT folk of color have insurance compared to every other group in the upper 80s and 90th percentiles. So clear disparities across the board. And again, one of the things I mentioned is I only gave you data that was specific to LGBT. There was no mention of transgender individuals in that group. And that's part of the complicating factor in terms of getting good data so that we can talk clearly and have an intelligent conversation about disparities, because in research studies overall, we're not very inclusive of sexual and gender identities. As was pointed out earlier, and I think this was the point that Caryn was referring to, is the fact that how we choose to identify ourselves when we participate in studies and when we go to the physician in order to be able to change perceptions and be able to get better data that we can use to create policies to make some changes and shift the disparity so that in 10 years we're not having these conversations. Part of my clinical practice is taking care of young adults who are HIV positive, newly diagnosed, and also taking care of their treatment early on. And one of the things that continues to bother me is that in spite of all of the advances we've made in terms of treatment, in spite of all of the advances we've made in terms of preventative messages, we, young MSM of color, because not everybody identifies depending upon that, we continue to have statistically significant increases in incidence when everybody else is bound out. But at the same time, you would think, okay, maybe this is a clear disparity here. You would think that funding would go up to address that. You would think that preventative public health messages would go up to take care of that. And in fact, they've actually gone down, and it's a forgotten part of the community. So there will be lasting disparities in spite of all of the insurance changes that we've made. And I think it's something, and I'm excited that this conversation is moving beyond marriage equality, because issues of homelessness, unemployment, educational status, all of these other factors that impact health conditions are real major concerns and real life issues for a lot of people in our communities. And one of the other disparities that is a clear disparity also is smoking, which I haven't touched because we have an expert here who's about to give you lots more details about that issue. So I look forward to any questions that you may have, and thank you.